Welcome everyone. This is the first webinar of our special series on alcohol policy in Canadian municipalities. My name is Amanda Farrell-Low. I am a member of the Canadian Alcohol Policy Evaluation team here at the Canadian Institute for Substance Use Research. I also work in communications and knowledge translation here at CISUR. And I'll be introducing today's session and doing the first few introductory slides. And our topic today is Introduction to Municipal Alcohol Policy. So thank you everyone for joining us. We have, this is one of our most well-attended webinars we've done in a while. So thank you everyone for your interest. We're really excited to launch this series. We do have French interpretation available for this session. It's available by clicking on the globe icon in the bottom of the Zoom window and then selecting French. And if you click it again, you can also mute the original audio and all you'll hear is the interpreter, and you can also choose to turn on closed captions if you wish. I'd like to start with a land acknowledgement. As we gather today, we want to acknowledge that we're meeting on the traditional and ancestral territories of many Indigenous nations across Turtle Island. We recognize the enduring presence, resilience, and sovereignty of First Nations, Inuit, and Métis people who have stewarded these lands since time immemorial. We honor the diverse Indigenous peoples and cultures across what is now called Canada, and we affirm our collective responsibility to learn about the histories of the lands we live on and work on, and to commit to ongoing reconciliation and respectful relationships. We offer this land acknowledgement as just one step of many towards understanding, respect, learning, unlearning, and healing on the path to reconciliation and reconciliation. And as the host organization for today's session, I acknowledge and respect the Lekwungen, Songhees, and Sapsem Esquimalt peoples on whose territory the University of Victoria stands, and the Lekwungen and Wasanich peoples whose historical relationships with the land continue to this day. We believe it is particularly important to acknowledge traditional lands when talking about alcohol and other drug policies, which have disproportionately impacted Indigenous peoples in Canada. And we recognize that we have attendees tuning in from across Turtle Island today, and we invite you to post in the chat box your land acknowledgement if you wish to do so. So this webinar series is an initiative of the Canadian Institute for Substance Use Research at the University of Victoria and the Canadian Alcohol Policy Evaluation Community of Practice. This is supported in part by funding from the Social Sciences and Humanities Research Council. In addition to funding from SSHRC, we acknowledge the support and collaboration of the CAPE co-investigator team and their institutions, knowledge users, partners, and CAPE COP members. Many of whom are in the audience today, so a few familiar names and faces, so that's always great. Please note the views and opinions expressed as part of this presentation are those of the presenters and do not necessarily represent those of our funders or other organizations acknowledged. So why this webinar series? As mentioned, we've been, the CAPE team has been working on alcohol policy evaluation and knowledge sharing at the federal, provincial, and territorial level for quite a while. And this webinar series came about as existing partners and COP members expressed a need for greater information about evidence-based policies at the municipal and local government level. We heard that people wanted to learn more about alcohol policy at that level, and specifically some of the things that were brought up as topics they wanted to explore were legal frameworks, research evidence, guidance, and resources available, to hear from counselors and practitioners across Canada about alcohol policy initiatives in their communities, what works well, what challenges they faced, and local level impacts. And we also wanted to connect with people across Canada who share an interest in alcohol policy and provide input into research priorities that can support alcohol policy at municipal, local government, and our community levels. So one of the main aims of this series is to foster knowledge exchange. There's a lot that us on the research end don't know, so that's why we're all here. We're hoping to learn from folks on the ground with experience in alcohol policy at local government levels. So as always, we welcome feedback from the webinars and any of the information gathered on the sign-up form and the feedback. They'll be used to help us develop subsequent webinars, topics, presenters, formats, and dates. So you'll notice we've only talked about this one and the next one in terms of what we're offering as in terms of what's scheduled. That's because we are really still developing our agenda and our plan for the next several months. So please email us and let us know if you have an idea. If if you want to present, you have a great example from your community that you want to talk about, please get in touch. And just a reminder that this webinar series is open to the public and that anyone can attend. So a little bit different from our CAPE COP members only offerings. So please keep in mind that the membership eligibility criteria that applies to the CAPE COP members only events is not applied to this series. So everyone is welcome to attend. So some technical things about today's session. It will be in English and it includes 3 presentations with a Q&A, 90 minutes total. As mentioned, we do offer French interpretation as well. We will be recording the presentation section of today's event, but not the Q&A, and we will also be providing an event summary after the event. We invite your feedback. As always, we'll be sending a survey link that will appear at the end of the webinar, and we'll send it via email afterwards to get your feedback on today's event. For persons with lived and living experience, we do offer honorariums. If you did not already indicate on your sign-up form, please email us at that email address there. You only need to let us know once. We do track it, so then we will track the honorariums. And if you're joining us via the phone today, that's the only way we can't track it because we just see the phone number, not your name. So please email us to let us know that you attended if you would like an honorarium as a person with lived and living experience. So these are coming fast and furious, these webinars. Our next one is next week, next Thursday, September 11th. And that one is legal framework for developing a municipal alcohol policy. So if you haven't registered for that one and it sounds interesting, please do. So I'll also be assisting with moderating the Q&A portion of today's webinar. The easiest thing to do is use the Q&A tool to submit a question at any time, and you can also submit questions anonymously this way. That way it's easier for us to keep track of what questions have been asked and what we haven't answered yet. During the Q&A that follows the presentation, you can also ask your question verbally if you like. Just use the raise hand functionality in Zoom. And then if you want to ask your question out loud, that's more than welcome. For questions in French, please submit them via the Q&A tool rather than raising the hand, because we're going to get our lovely interpreter to translate them into English for our presenters. And then she can, so hopefully then we can get some cross language communication going. So that would be great. And if you experience any technical difficulties, please message us in the chat or click ask for help, and one of the admins on the webinar, myself or Tina or Bella, will do their best to help you out. So today's presenters, we have myself and 2 other presenters today. First up is Ashley Wettlaufer. She has expertise in monitoring and analyzing the implementation of alcohol policy and its effects on population health. She has extensive experience helping people translate evidence-based research into actionable alcohol policy initiatives across all levels of government. Ashley has worked on the CAPE project since its inception in 2011, so it's been almost 15 years that Ashley's been doing this work with us on CAPE, which is wild, and has collaborated on resources including Municipal Alcohol Policy Primer, Alcohol Policy Review of Opportunities for Ontario Municipalities, and the Centre for Addiction and Mental Health's Alcohol Policy Framework. Ashley was an advisory committee member for Alberta's Municipal Alcohol Policy Project and is currently a technical expert for development of a national alcohol policy for Greenland. And after Ashley, we have Lorelee Marin. She served as a city councilor in Lloydminster, Alberta, Saskatchewan until 2024, and is a seasoned health promotion facilitator with Recovery Alberta. She brings a wealth of leadership and collaboration to her work, championing initiatives that promote community well-being. Lorelee has held key roles in local and provincial collaborations, including the Alberta Committee on Tobacco and Vaping, the Provincial Advisory Council Cancer, Lloydminster Area Drug Strategy, the Alberta Municipal Alcohol Project, Cannabis Let's Talk, and Lloydminster's Social Policy Framework. At the heart of Lorelee's work is her visionary 100-year plan to foster belonging, resilience, and community well-being. So looking forward to hearing from both those presenters today. So our objectives for the presentation today, by the end of the session, we're hoping that our participants will be able to describe alcohol consumption, revenue and costs and harms in Canada, provide rationales for population level alcohol policy approaches, describe local level policies and strategies across Canada that have effectively balanced public safety concerns with community needs, and identify resources and tools available to help guide alcohol policy development and advocacy. So I'm going to get us started on objective one, and then I'm going to hand it over to Ashley. So we're going to start with a quiz. Fun. Uh, so this is alcohol sales. How many standard drinks per person age 15 plus were sold in Canada in the year 2023-24? If anyone wants to throw a guess in the chat, that'd be great. So this is our most accurate way of measuring alcohol consumption, is the sales data that is collected by the government. So how many standard drinks per person over the age of 15 were sold in Canada in the year 2023-24? I'm curious what people say. Okay, we got answers all over the spectrum here. All right. The answer is actually B. So the 2023-24 was one of the lowest, I think maybe the lowest year for alcohol sales in Canada since Statistics Canada started recording it. So it's down to 428 standard drinks a year, which is a little over 8 a week. And just to note that this is a national average, so it really varies between jurisdictions. So for example, the number was 13 standard drinks per week for the Yukon and 5.3 for Nunavut. So a pretty wide variation, and everyone else was kind of at some point in between those two numbers. And this is likely an underestimate, as the calculation includes the whole population of people over the age of 15. So that includes a lot of non-drinkers. And the percentage of people in Canada who don't drink is estimated to be about 1/3 of the population, and it's actually increasing. And this decline is even more impressive when you remember that in 2020, 2021, we had hit record highs of alcohol sales during COVID. So and some provinces and territories have access to more regional sales data. I know here in BC we do. We'll touch on that a little bit. So there may be ways for you may be able to find more localized data for your community as well. But Statistics Canada only presents by national and provincial and territorial. So just a question to kind of get started with. Does the sale and taxation of alcohol deliver a profit or loss to Canadian federal, provincial, and territorial governments? I know that today's session is about municipal level, but the data from the next few slides, I'll be talking about national, provincial, and territorial data because that's what we at CAPE have been working with for a lot of years. And there's a lot we still don't know about the municipal level, which is why we're all here. So that question, if you look at the news headlines, you'd kind of think it's a big moneymaker for the regions, right? Federal and provincial governments derive revenue from taxing alcohol and in most provinces selling it directly in publicly owned liquor stores. And this includes excise and sales taxes and public profits on sales and licensing fees. So these headlines kind of give you a snapshot of some news headlines about alcohol revenues. And we often hear that alcohol sales are a significant source of revenue for Canadian governments. However, we don't often hear about the costs of alcohol harms when we're looking at these headlines. So, for example, in 2023-24, governments across Canada earned $13.5 billion from the control and sale of alcohol. However, if we account for the costs of alcohol harms, we find that each province and territory actually incurs a deficit from alcohol. So we're presenting 2020-2021 data here because that is the latest year we have data from the Canadian Substance Use Costs and Harms study. They are updating that, so we'll see more updated data from there soonish. So this is what we like to call the alcohol deficit. In Canada, it was calculated at $6.4 billion in 2020-2021, and that exceeded that of tobacco and opioids combined. So if we look at this, we have the net revenue as reported by Statistics Canada for each province and territory. And then we have the harms and costs for each province and territory as reported by CISUR, and we see the deficit here. So it really ranges. And then we've calculated at a loss per standard drink. So for every drink sold in each province and territory, this is how much money the government loses. You'll notice there's a little asterisk on the Quebec number because we have incomplete data on some of the costs in Quebec. And so it really varies. And as you can see, for somewhere like Nunavut, it's quite, it's $18 per standard drink, which is a lot of money. So again, these are provincial and territorial numbers. Communities and municipalities could use local data to calculate costs to their communities using economic impact assessments. I think Lorelee, she had mentioned some communities that had done that that she's familiar with. So let's look at the types of alcohol harms that CISUR includes in their calculation for provincial, territorial, and federal levels. So we've got things like lost productivity, criminal justice costs, healthcare, and other direct costs like, damage to vehicles, fires, social assistance, that kind of thing. And if you're curious about exploring this data for your home province or territory, the CISUR website has a great data visualization tool where you can really kind of get down into the weeds a little bit, which is great. And here's one example of just for BC in terms of its costs, alcohol's costs to governments compared to other substances. As you can see here in BC, it's 38% of total costs to BC, so larger than tobacco and opioids. And the national average is about 40%, so BC is kind of right around the average for that. And this example is from an interior health report that we'll be sharing later as well. So alcohol also, it has big impacts on health and safety. Many of these are very relevant on the municipal level. Hospital admissions, preventable injuries and deaths, assaults, intimate partner violence, collisions from alcohol impaired driving. Alcohol is causally linked to at least 7 types of cancer and over 200 health conditions, injuries, and diseases. And I know that health costs are not the purview of municipal and local governments, but we have to remember these are people who live in our communities who are impacted by this health-wise. So while the money may not be coming from municipal and local coffers, these are our community members and people who live in our cities and towns and villages who are affected by these health impacts. Also, fetal alcohol spectrum disorder is a lifelong disability and impacts about 4% of the Canadian population. And 1 in 4 crash deaths on roadways involves an impaired driver. And 459 people were killed in alcohol-related road crashes in 2021. And over 40% of crimes committed by offenders admitted to Canadian federal institutions were associated with substance use, with alcohol responsible for the greatest proportion of these. And I also wanted to touch on alcohol's impacts on health and safety in terms of like kind of a social justice lens. So the same level of drinking by people in lower and higher socioeconomic status groups is known to result in higher levels of harm for those with less resources. So for people with less resources, they experience a disproportionate level of harms, regardless of whether they, when they drink at the same amount of someone with a higher socioeconomic status. That's known as the alcohol harm paradox. High proportion of alcohol consumed by young people and is in the form of binge drinking, which has much greater risks. Men are more likely to be involved in alcohol-impaired collisions, injuries, and violence, and women are more likely to be victims of alcohol-related sexual assaults and violence. So alcohol-related harms are unequally distributed across populations and have social justice dimensions. And sometimes alcohol policy changes on the local level, such as one that we've done a little bit of work on is allowing drinking in on parks and beaches. Often that's framed as a more equitable solution for our communities, But the research has showed us that different groups of people in our society can experience disproportionate harms from alcohol. So these are important to keep in mind. What I might feel is a more equitable thing because I want to have a beer at the park is actually going to negatively impact other people. So these are important things to keep in mind. And now I'm going to hand things over to Ashley.
Thanks, Amanda. Sorry, I got distracted by the great questions already flowing in the chat. So thanks for that really important context. Now I just want to shift from provincial and territorial context to think about our specific communities. So thinking about the information Amanda has shared with you and what you know about alcohol in your communities, whether it be from the work that you do or your personal experiences, I just invite everyone to reflect on the role alcohol plays in their local communities and to think about whether they see alcohol as more of an economic asset or a public health and safety concern. So as a public health researcher, I can't help but think about the public health impacts. Things I think about are the 200 plus alcohol-caused disease and injury conditions associated with alcohol use, impaired driving, the violence that's fueled by alcohol, intimate partner violence specifically is an area that I've done some work in. And then just thinking about the strain on families, workplace productivity, and the public services, all things that Amanda has been mentioning. But we've also heard a lot of messaging in the media lately, and these issues aren't really present. And Amanda was showing us this with the various headlines. And I'm located in Ontario, and in Ontario, with the expansion of alcohol sales, we've heard a lot about the economic assets. So the benefit of jobs in bars, restaurants, and retail environments. Specifically in the moment right now, we're very focused on the job creation for small businesses and corner stores, etc. We hear a lot about and why that is. So we'll move to the next slide. We've been talking a lot about costs, and those of you that are familiar with the CISUR study probably know the data better than I do. But what I want to think about is what these costs look like from alcohol at the local level. So we've talked a lot about healthcare costs, but there's also significant policing costs from violence, public disturbances, vandalism, impaired driving, and these costs are significant. Amanda was telling me about a report just the other day that 20 to 40% of municipal budgets can be dedicated to policing costs. And RCMP data shows that 50% of police interactions in Ontario involve subjects perceived to be under the influence of alcohol or drugs, and this can be up to 85% of interactions depending on the jurisdiction in Canada. A number of years ago, we had Toronto Police Services report to us that up to 80% of policing resources can be concentrated in the downtown entertainment district in Toronto on a Saturday night. So we're talking about very significant costs in terms of police. Other emergency services as well. So these are largely borne by municipalities. So policing services, including OPP costs that are recovered through cost recovery basis, fire, land ambulances, these are all borne by the municipalities. Bylaw enforcement, so even though the AGCO or the provincial regulator issues the licenses, a lot of the enforcement duties fall to municipalities. For example, event permits, noise and nuisance bylaws, enforcement of alcohol in public spaces, whether that's permitted or not, municipal alcohol policies on municipal properties and assets, all require enforcement resources, often supported by local police or bylaw officers. There's significant costs to local businesses. There's business licensing fees and conditions, which often carry requirements around security, crowd control. There's training requirements, insurance and liability requirements, as well as property damage and vandalism that can result from alcohol use. And then there's the social costs, the secondhand impacts on friends, families, coworkers, and the broader community in terms of the noise, the nuisance, the public disturbance. And these costs are exacerbated in smaller and rural communities due to limited resources and access to services. And this last point is important because I often hear from smaller communities that they're hesitant to restrict alcohol because of the economic benefits they see in their communities. They often cite to me, that the alcohol partners with the alcohol industry partners with local sports teams. They sponsor community centers. They bolster tourism, and there's nightlife benefits for their community. One community I was working with really was focused on the benefits of and the revenue that they generate from event licenses for stag and does. So couples that are getting married, throw parties, alcohol is a central component to these, and they make a lot of revenue through their community centers and through these event licenses. What we need to consider is the true cost of these sponsorships or these events. So while businesses may be providing sponsorships or attracting tourism, enhancing community appeal, alcohol purchases are largely from discretionary spending. So I'm not talking about people who are dependent on alcohol, but for the vast majority of the population who drink, they spend their disposable income on alcohol. And whether that is spent on alcohol or on other activities, it doesn't mean that if we remove alcohol or we restrict alcohol, doesn't necessarily mean that that money isn't spent in the community. There's other activities that it may be spent on, and there would be a shift in terms of spending, perhaps more healthful behaviors like wellness tourism that we're seeing a surge in, arts and cultural events, music festivals. So, just thinking about the true costs of these sponsorships and the true cost of alcohol in the community. So moving along, it's not all bad news. There are ways to reduce the negative impacts of alcohol, and the most effective way to do this is through population level alcohol policy. So alcohol policies are amongst the most effective tools to reduce these harms and costs and positively influence community well-being when it comes to alcohol. So they can change the alcohol culture by altering the alcohol environment. So for example, they can shape outlet density or the placement of outlets. They can dictate the placement of ads or whether alcohol advertising is permitted or banned altogether, whether drinking in parks or public spaces is permitted, etc. This helps shift the norms around alcohol. So whether it's used, when it's used, how it's used, what is acceptable or not in society or in our communities. So for example, wide adoption and promotion of the Canadian guidance on alcohol and health can shift population level knowledge and perspectives on alcohol consumption through informing the public of the health risks from alcohol and how to mitigate these risks, and in turn shift drinking behaviors. Likewise, advertising bans can help prevent the further normalization of alcohol use. Population level policies can lead to changes either directly or indirectly in drinking behaviors. So policy can influence if and when someone starts drinking. We know that this is very important because early drinking patterns, so early in life, alters the lifetime drinking trajectory for an individual. And this can be quite powerful in terms of the health harms an individual and a population experiences from alcohol. The effects of policy are well documented in terms of influencing how much or how often people drink and the contexts in which they drink. For example, pricing controls are highly effective in curbing consumption amongst the highest risk drinkers. Restrictions on late night sales are associated with lower rates of harm due to lower levels of intoxication. The real benefit of the population level policies are that they affect the entire population, not just heavy drinkers, not just drinkers. And this is important because if we think of the entire population as following on a continuum from abstinence to heavy drinking, these policies help shift everyone down the continuum. And this is so effective because the harms from alcohol can start at relatively low levels of consumption. So no matter where you are on this continuum, a reduction in drinking can have positive impacts for the individual in terms of reducing harms and costs. And this is especially impactful at the population level. Next slide, please. So as we move along and think about these terms and the harms and costs and what alcohol policy is, I want you to think about what you know about alcohol policies and how that might apply at the local level. So what comes to mind for you when we say alcohol policies or we talk about alcohol policies? So there are some seminal documents in which the evidence on a range of alcohol policies is summarized, and we wanted to share these with the group because they're documents that have really been useful in the work that we do. So starting on the left here, alcohol and ordinary commodity, it really has been touted as like the alcohol policy Bible. It covers probably any alcohol policy you could think of. And what I find really valuable about this resource is that it summarizes the evidence in terms of the quality, sort of in the breadth and depth of the evidence. And it helps prioritize the interpretation of the evidence. So it really helps boil things down quickly, especially if you're starting out in this world of alcohol policy. And it's a great starting place. Next is the NCD report by the WHO, better known as the WHO Best Buys. So this resource looks at alcohol policy from a cost effectiveness standpoint, and they've sort of discerned what the best bang for your buck policy would be in terms of cost to implement and the return in terms of reducing harm from alcohol. And they prioritize the top three Best Buy policies, which are taxation, advertising bans or comprehensive restriction, and physical availability controls. So things like controlling hours and days of sale. And the next resource, the Safer Package, is also a WHO resource that is similar to the Best Buys, but it expands this to include prioritizing impaired driving and screening brief intervention and referral programs. And then finally, we have the CAPE resource, which is the Canadian-specific resource. It's Canadian Alcohol Policy Evaluation. So we take the best practice evidence on alcohol policies, mostly from the resources I'm talking about, and we look at the implementation of the best practice policies across Canadian jurisdictions, including the federal, provincial, and territorial governments. And with future funding and a little luck, we will be expanding this to include more of a municipal focus as well. So moving along, the evidence shows that preventative alcohol policies contribute to improved safety and well-being of citizens and communities. At the community level, alcohol policies are associated with a wide range of benefits. This includes reduced underage access to alcohol. As I mentioned, this is important because this can alter lifetime drinking trajectories, which can have significant health impacts. Reduces community disruption, fewer injuries and hospital visits, which Amanda was talking about, reduction in impaired driving, enhanced safety, and reduced demand on policing resources. And all of this culminates in reduced costs to taxpayers and reduced legal risks for local governments. If you've been around for other CAPE Community of Practice events, you likely have heard us talk about consumers' right to know about the risks associated with alcohol use and the duty to warn that is borne by local governments and provincial territorial governments. So yeah, they have a role in informing the public about the risks, and alcohol policy is one avenue for them to do that. So we talk about alcohol policy, but what are the specific policies we're talking about? Broadly speaking, the key policy areas include pricing, so things like taxation or minimum pricing, which is when the government sets a floor price below which alcohol cannot be sold. Availability restrictions, such as limits on hours and days of sale, impaired driving countermeasures, so things like sobriety checkpoints, marketing bans and restrictions. These can be restrictions on content of marketing or the placement of ads or the volume of ads, so how many ads are put out. Health and safety messaging, this could look like public service campaigns, but also warning messages in drinking establishments or even labeling. And then liquor law enforcement programs to enforce the various regulations and bylaws around alcohol. But before we can talk about which of these policies can be implemented at the local municipal level, we need to sort of understand very broadly the division of powers between the various levels of government. So starting at the top, we have the Constitution Act that divides the powers. We get the federal government has powers through things like the criminal code. So that allows the federal government to control impaired driving through their countermeasures because it would be a criminal act to do so. Cross-border trade is controlled through the Importation of Intoxicating Liquors Act. We have the Excise Tax Act that allows excise tax and duty to be applied to alcohol. And we have the CRTC code that regulates broadcast advertising at the federal level. Then the provincial governments get their powers through their liquor license for control acts. So that's a specific act to Ontario, but each jurisdiction has a similar act at the PT level and corresponding regulations that govern who may sell or serve alcohol, where it may be served, the hours in which it may be sold, compliance and compliance measures and offense schedules. So they also have a separate piece of legislation that creates the provincial regulator, in Ontario's case, the AGCO, Alcohol and Gaming Commission of Ontario, and that's created under the AGCO Act that creates that body. And then the municipal government largely gets their powers delegated to them from the province. So through the Municipal Act, the Planning Act, and through business regulations, and then other bylaws that they have control over, so noise bylaws, nuisance bylaws, etc. So if we look at this division of powers in relation to the alcohol policies I listed I think 2 slides ago, it looks something like this. So I just want to note that there's no one-size-fits-all division of powers across province and territories. That would be too easy. In fact, Kate will be hosting a webinar next week to present on a legal framework for municipal alcohol policies that Professor Robert Solomon has been working on with his law student Elise. They're part of the larger Kate team, and this work digs into the legislation in Ontario and BC, I believe, to discern which policy options are available to municipalities in those provinces. But looking at this chart, you will see that there's significant overlap between the policies that can be acted upon by different levels of government. For example, all levels of government control or influence elements of the distribution and sale of alcohol in different ways. Ideally, these pieces come together and they can complement each other by working together to create a comprehensive regulatory framework that balances the needs of the wider provincial and federal objectives with one another. For example, the Importation of Intoxicating Liquors Act at the federal level reinforces the provincial liquor boards by making it illegal to import alcohol into a province except through provincial authorities. There's been some modern amendments to that, but I digress. This framework here that's presented is by no means a comprehensive framework, but just a breakdown of some of the policy division to show in a more practical sense, the division of powers. And I'll just note that some of the potential powers that could be leveraged have not been actualized in Canada. And those have been noted in gray. I'll just draw out one of the examples here is the minimum legal age. So the way the legislation is structured, the federal government could implement a federal legal age. They could do that, for example, through the criminal code. They could make it a criminal act to sell alcohol to individuals below the age of 21. They don't do that, but they could. And instead, we have this addressed at the provincial territorial level. And as a result, we have an inconsistent age across jurisdictions between 18 and 19. So moving along to an example from the policy guide for Alberta, you can see here that there's significant overlap between each level of government in terms of both what could be done and what has been done in terms of regulating alcohol. In general, so this is just an example we wanted to share. It's similar to the framework on the other slide. This resource is very helpful in terms of breaking down which level of government could potentially act in certain ways on different policies. In general, it's important to note that municipal policy must meet standards, the minimum standards set by the province and federal authorities. So, for example, a municipality cannot set a minimum price different than what's set at the provincial territorial level. However, if a province or territory does not set a minimum price, but regulation allows for it, a municipality could set a minimum price for alcohol. And in fact, was done in 4 municipalities in BC and has thought to have influenced price policy at the provincial level. Okay, so moving on, thinking about this information and the examples we saw from Alberta, what role do you think local governments can or should play in addressing alcohol-related harms? We just want you to sort of reflect on that as we move along. I'm cognizant of the fact that I've talked a lot about municipal policy and haven't really defined what we mean by that. And that was somewhat intentional up until this point. We didn't want to get caught up in the nuances of the different ways to define municipal alcohol policy. But let's address that now. So today we use the term municipal alcohol policy to mean any policies implemented at a municipal level that impact the control and sale of alcohol. Policies could range from individual bylaws to a complete comprehensive range of policies at the municipal level. Historically, minimum alcohol policies, or MAPs as they've been known, have referred to a set of policies that pertain to the control and sale of alcohol on municipal assets or properties. And municipalities began creating these sometime in the 90s in response to liability and public health concerns. And MAPs often establish where alcohol is and is not permitted on municipal properties and sets the conditions for things like special event permits, for example. In this work, we're blowing that wide open, and we're saying that municipal alcohol policies we're now believe can have a broader scope, and we're now exploring that more broadly in terms of any municipal policy. We recognize that the more broadly defined municipal policies we are discussing today may be relevant to a variety of local government structures, including municipalities, local and regional governments, and First Nation governments. So we've tried to structure our language intentionally around that. Although we say municipal alcohol policy, we really mean local alcohol policy. We acknowledge the diversity of systems and contexts at the community level across Canada, so different geography, like rural and urban differences in terms of the municipalities. The challenges are quite different in terms of large or small municipalities. And the types of alcohol policies will vary between municipalities, as do the reasons for developing and implementing them. Any solutions will need to be tailored to each community, and this here is what makes municipal policy such an asset, because it gives an opportunity to address local needs and context in a highly tailored way. As Amanda said, I've been involved in the CAPE project, which focuses at the federal, provincial, and territorial levels for a long time. And when we present those findings, we almost always have feedback from folks working in municipalities to say, yes, but this is a one-size-fits-all approach and it doesn't quite work for my community for these reasons. And we always say that that's where the role of municipal policy comes in and allows those nuances to be addressed. So I've talked a lot about division of power, types of policies, and the different levers and their role in reducing alcohol harms and costs across all levels of government. Just to summarize here, the population level policies have far-reaching impacts across the population by acting on the conditions and contexts in which the decisions are made and people live their lives. And this is what makes them so impactful, is that they are addressing harms at a population level. Municipal decision makers and influencers have a unique privilege to shape their communities by implementing alcohol policy at the local level. And appropriate policy interventions can address and reduce inequalities. And Amanda sort of introduced us to those earlier in her slides. And we have an ethical responsibility to embed equity considerations in planning and design of these policies and even evaluating them. So what are some of the tools available to municipal and local governments? Again, Professor Solomon will be presenting on this in more depth in terms of a legal framework for municipalities next week, September 11th. But here are some and we're going to hear some examples from Lorelee in a few minutes. But municipalities and local governments can shape the alcohol environment and mitigate alcohol's risks and liability through a variety of tools. And some of these include bylaws related to land use and zoning, so influencing or controlling location and density of retail outlets, or their placement in terms of whether they're next to schools or rehabilitation facilities. Their control over municipal spaces like parks and recreation, especially the sponsorship of these spaces and events that take place there, is especially powerful. They have control over public transit and signage in public spaces. So in a sense, they have control over the messaging that goes out to their communities. And some of the more creative policies I've seen have been implemented through business licenses, which is a municipal requirement in a lot of jurisdictions, where if you're going to sell alcohol, you have to have a specific business license, and they can set conditions through this business license. And the minimum price that I mentioned in BC was actually implemented as a condition of the business license. If you were a business that wanted to sell alcohol, it had to be sold at a minimum floor price. And then municipalities can set conditions of special event permits and play a large role in enforcement activities through bylaw officers and policing. But because we know how helpful real-world examples are, I'm going to turn it over to Lorelee to speak to some specific examples.
Well, thank you, Ashley, for that very great overview of municipal alcohol policy and the opportunities that are available to municipalities. I'm delighted to be here to share some stories of real life municipal examples and my own experience with municipal policy. I wanted to dive a little bit deeper into two areas that I've worked with directly, so availability and safer drinking environments. I've seen these two issues from two perspectives. First, as a health promotion facilitator in mental health and addictions, and then as a city councilor. And it was always surprising to me how my two roles intersected in health policy and healthy communities and community safety, alcohol policy, housing, all of those things. And so this webinar series will dive deeper into those policy areas, but I'm excited for the fourth webinar in the series that will be presented by MAD Canada. And in subsequent webinars, we will explore more deeply the steps in policy development, implementation, and evaluation. So get registered for those. Today, we hope to share what is possible by sharing some of the examples of municipalities and communities who are working together as partners to develop alcohol policy. And so when we think about regulating availability, what does this mean? And so we have land use bylaws that can be applied to regulate the location in which an alcohol establishment operates and the hours in which it operates. She did a great job kind of highlighting that. Why is this important? And when we talk about availability, we're really talking about access. And there's this strong direct correlation between alcohol availability and harm, and increased access leads to higher consumption and associated problems such as violence, injuries, impaired driving, and increased risk of heart disease or cancer. And conversely, reducing availability leads to measurable reductions in those harms. So high density of alcohol outlets is the strongest predictor of violent crime in neighborhoods, surpassing socioeconomic factors. And it also correlates with youth drinking, suicide rates, child abuse, and alcohol-related mortality. And so some of the policy options, I'm just going to skip past this because I think Ashley did a great job, and I want to tell the stories to inspire you to what's possible in your community. I just would say when you're approaching alcohol policy from the municipal or community lens, it's important to watch for changes in provincial and territorial regulations as well. Or like me, you may be surprised by some of the changes that just pop up and you miss the consultation and the engagement on that. So here are a couple of examples from Alberta citing that these changes aim to reduce red tape and promote a competitive market. And so one was liquor retailers can now open in underused commercial spaces with separate entrances. So that could be like next to gas stations and strip malls and in malls, places where we didn't typically have liquor outlets before. And that local producers can advertise and serve alcohol on party bikes. I mean, who knew? I just want to make a quick comment on party bikes. They originally started as a way to promote heart health, exercise, and connection. And now we're having them as party bikes. And so what other regulations might apply to that? Let's think about the standard drink size. Is that regulated on the party bikes? It should be. What about over serving or safety and preventing people from falling off the bike in traffic? And there's so many things to consider, and municipalities have the opportunity to do that. Provinces' evolving stance on alcohol retailing and marketing, like party bikes and farm gate sales and farmers markets, shows how provincial policy can really influence local bylaws and community norms. And so municipalities, we must stay agile and proactive in adapting our municipal alcohol policies to align with or respond to those changes. And so, back during the pandemic, we saw a change in regulations with the adoption of alcohol delivery as an approved practice. This was a surprise to my small community. And all of a sudden, we saw taxis and local entrepreneurs with seemingly little oversight begin to deliver alcohol. We were all having this conversation online. What's going on here? We heard these stories. And I first learned of it when I heard about a young person having alcohol delivered to their home, left on the doorstep with no request for identification to show their age. This quickly became a great concern in our community and in others. But it was during the pandemic, and we were already experiencing significant overuse of alcohol. And we weren't anticipating or have the capacity to respond to that at the time. Certainly something that we have on our radar now. I can't think of any policy changes in favor of health at the provincial level or territorial level, at least in Alberta. Perhaps you have something that you would be able to share with us if you're aware of health promoting policy changes around alcohol. I have a couple of examples for you to think about, and perhaps you have similar situations in your municipality. So a couple of weekends ago, we took our grandkids to the Edmonton Zoo. I have 6, number 7 on the way, just plugging that. And we were so surprised to see the promotion and sale of alcohol at the zoo. We hadn't been since our kids were little. And so this was a big change. And we just were like, really? Alcohol at the zoo? We're here with our grandkids. And there was a lot of families there. But there are exhibits sponsored and named after alcohol products that were for sale, and people were walking around with their alcohol beverage they had purchased on site. And we had the morning tickets. It wasn't even afternoon or evening. Municipal approval of liquor sales at the zoo would have been required. And so I'm curious, what were the pros and cons lists that led to approving the site for liquor sales? What was involved in the consultation and engagement to make that decision? There's this responsibility of the municipality to really do what's best for the community in terms of their health. And I just would like to know what the consultation was around that. And I've also learned that Canada's Wonderland is licensed, and I suspect that many family-focused venues are as well. I was invited to a yoga and wine event, and I just laugh at the irony of that. A yoga studio having a liquor license to entice people to come do yoga at their studio. The liquor is free with your event ticket purchase. Again, I'm curious about that approval process. And then on New Year's Eve, the Ukrainian club hosts a family dance. And when families enter the event, the adults are handed a free shot of vodka that they are to drink before they go inside. Is there peer pressure to participate? What if you've decided not to drink or you don't drink? What if you're living in recovery and this is handed to you as an expectation? I want you to consider the modeling for children and the normalization of alcohol at yet another family event. And so when we understand the risks, we can use a harm reduction approach. And I have engaged in some conversations with them about how they could offer different alternatives to the shot at the door. And so perhaps a free drink ticket, maybe offering a low alcohol beverages inside or alcohol-free options, and highlighting for them the liability concerns and public safety, as well as the modeling for children. Recently, summer and the fairs are all in the small towns. And so I was with my dad at the fair in the small Saskatchewan community where he lives. And so many families were out to enjoy the parade, and then they headed to the fair. And we stopped at the local gas station, and it was busy. All the pumps were full, and the parking lot and the street were full around it. The liquor store is in the gas station, and families were coming out, kids with Slurpees and parents with their liquor. I was so sad. The municipality, a small town, thought that this was economic development. If only they had the information from this series to understand the costs associated with this decision, and that, in fact, it is not economic development for the town, only for the business. I was just going to talk a little bit about some of the policy options available, but I think I'm going to leave that because we're going to share some good resources with you, and Ashley's done a great job of covering that already. Just some questions to consider. How many alcohol establishments are already in the community, and what's the real need? What's the percentage or the number of alcohol establishments per population? How will the proximity of alcohol establishments or licensing for events affect a particular area or neighborhood? And has there been an impact study? And would drinking at an event require more resources to manage it than event hosts can provide? And so all things to consider when we're doing some policy. And municipal alcohol policies are not just like regulatory tools. They are really community health strategies. And so moving into the safer drinking environments, what does this mean? Well, a key factor in addressing alcohol-related harm involves the environment, the context or the conditions in which alcohol is being consumed. And municipalities have the ability to apply policies and practices to ensure that those precautions are taken inside and outside of alcohol establishments. And so some of the safer drinking environments are shaped by staff training, ensuring responsible service and intervention skills, signage, clear communication of rules and boundaries, and crime prevention through surveillance, lighting, and crowd control. And then that environmental design, physical layout that separates alcohol zones from family. I'm just going to mention a health impact assessment, and I think Ashley mentioned it before, but that's an important step to support municipal decision-making. Health impact assessments, they evaluate how alcohol policies affect health outcomes like injury rates, cancer rates, and suicide. Health impact assessments ensure equity and safety are considered in the decision-making process. So digging a little deeper and knowing the questions to ask when a decision is important, it's really important when you're developing policy, just having some experience or a group of people who are working together. So I want to share with you a story, headline versus reality. And so when I was serving on city council, the city of Edmonton adopted a policy to permit alcohol in some of the parks. The headlines for this project led some of my fellow councillors in Lloydminster to believe that there were no harms associated with this decision and that, in fact, we should be considering it in our municipality. And so here's one of the headlines. Edmonton's pilot allowing alcohol in parks was made permanent after 80% public support and few reported incidents. So it's important to know that the focus of the feedback survey was on noise and garbage. and not on human experience. And when you look into the survey data beyond the headlines, it showed that 17% of respondents had safety concerns, especially among Black, Indigenous, people of color, women, and immigrant communities. And when residents were engaged in conversation about the policy, we learned that newcomers and families and people living in recovery reduced their park use. They reduced their park use, and they chose locations that were alcohol-free spaces. How sad is that? So I was able to share with my council and city administration the impact of the Edmonton decision beyond the headlines by looking deeper into the report and connecting with local individuals who were engaged in the community and with residents who had concerns not collected on the survey. City Council agreed to not approve liquor use in Lloydminster parks. No special events or permits, including Canada Day. That was a bit of a battle, but it was a good one to walk away with. And I will share a little bit more about that prep work when we talk about our alcohol policy brief. And just one more short story to inspire you to think about what's possible in community. Relationships are key. And in a small Alberta community, families were concerned about alcohol use in the arena during junior B hockey games. The practice was that you could consume alcohol anywhere in the arena. And for several years, we've been asking for a change to this practice as families were feeling uncomfortable and spectators were feeling uncomfortable about alcohol being anywhere. It also created some not so good interactions between the fan bases of the two teams. So through a conversation with the town, which is the facility owner, we learned from the new director of parks and facilities that the license only allows for a single designated location. And so this fall, the town will clearly communicate the designated location and provide some consequences if they're not abiding by the license. So we recognize that it might take some ongoing communication for fans to move into this new practice of one location, but this is a win for health and for changing the norm of how alcohol is used in the facility. So creating safer drinking environments is not just about enforcement. It's about designing those spaces that respect diverse needs. It's about promoting health and fostering community trust. So one of the questions I hear often is, where do I even find bylaws related to alcohol use? And the answer is, it depends. Sometimes you'll find them in parks and recreation rules, and sometimes in public safety or community standards bylaws. Almost always they will be found in the land use bylaw, or you can search on your website for municipal alcohol policy. They often are scattered in little bits and pieces. If you're doing this work in your community, start by scanning your municipal website. Look at the bylaw library, the Parks and Rec pages, event and facility booking rules, and even council agendas. And in a search of provincial liquor regulations, add that in and what the policies are by checking the Gaming and Liquor Commission or the Municipal Government Act. Some of the things that you might want to look for is like a bylaw library where you're searching, alcohol, liquor consumption, parks, etc. You might want to meet with the city clerk or legislative services if you need help understanding their overall approach to alcohol policy. You could ask your councilor that's representing your area or book a meeting with a committee from the city of councilors who are responsible for healthy public policy. And planning and development, they understand and know the land use bylaw, and they'll know how the bylaw is being interpreted and being applied in practice. And something important, the absence of a policy can be just as telling as the presence of one. And so if there's nothing in place, it leaves big gaps, and communities often don't realize the risk until something goes wrong. Next slide, please. So just a few here on this slide is just a few examples of municipal alcohol policies and guidance documents. We're going to share all of these with you in the resource page, and some of them will be featured in later sessions of our webinar series. I just wanted to say that there's many people on the call today who were part of being the advisory for the alcohol policy for community safety, vibrancy, health, and well-being, a practical guide for Alberta municipalities. And Ashley's shown some of the pieces from it already, and we'll share the link with you. But I also wanted to say in particular how wonderful it is to have the project lead, Zan Harvey Jansen, joining the webinar today, even though she retired at the end of June. And so congratulations on your retirement, and thank you for your significant investment in this legacy work. This guide has played a pivotal role in shifting Alberta's municipal landscape, transforming local governance by advocating for pragmatic, inclusive, and collaborative approaches to alcohol policy, and ultimately strengthening community health, safety, and vibrancy. I was going to share about some of the other examples, but I think I'll leave that for the next webinar. So next slide, please. A little bit more of a storytelling coming up in just the next couple of minutes, and then we'll move into Q&A. As someone who's had the privilege of serving both as a city councilor and a health promotion facilitator, I've seen firsthand how municipal decisions can shape the health and well-being of our communities. So in 2016, the Lloydminster Area Drug Strategy developed a tobacco policy brief that led to a bold move where council approved a tobacco licensing fee in addition to the regular licensing fee of $750 for retailers plus $350 if you sold flavored products. What made this policy truly special was where the money went into the Tobacco Reduction Grant, which is now known as the Safe and Healthy Communities Grant. And it supports local nonprofits working to improve health and safety, and very much that upstream prevention work. That same year, we proposed the alcohol policy brief advocating for a similar licensing fee for alcohol retailers. And while the brief was accepted, the fee didn't gain majority support. We tried again in 2018 and in 2020, especially when cannabis retailers were being charged now $1,500, but alcohol was left out each time. But we're not giving up. In 2026, we'll present an updated alcohol policy brief, and once again, we'll advocate for licensing fees that support community health, acknowledging that alcohol sales bring real costs to the community. Sometimes you win, and sometimes you wait. But there have been wins. And in August of 2016, the City Council amended its land use bylaw to require new liquor stores to be at least 300 meters from schools and parks and places where kids congregated. It was a move led by Councilor Jason Whiting after a presentation from our drug strategy team. It was a step forward, slowing liquor retail expansion. And then came the challenge. On September 16th, just a few short weeks later, while I was on vacation, the province of Saskatchewan called the city requesting a change to the bylaw to reduce the separation distance to 100 meters so they could sell their government-owned liquor store to a private owner. With the city's new bylaw, it blocked the sale. The separation distance was changed from 300 meters to 100 meters to accommodate the province's sale. This moment just reminded me that municipal and provincial relationships matter, and sometimes you win and sometimes you wait, but every effort always counts. Reflecting on the alcohol and parks policy and discussions that took place in Lloydminster, I just want to share quickly the feedback that we received from community members. In my role as Recovery Alberta as a health promotion facilitator and serving as the chair of the drug strategy, I set out to understand if the broad community would be supportive of alcohol and parks. And so this is what we asked. Based on your understanding of community values, public safety, and park usage, would you support permitting alcohol use with clearly defined restrictions in our Bud Miller Park? What factors most influence your position, and how do you see this policy impacting the community? We heard back from 12 RCMP members, from park staff, from newcomers, from people living in recovery, from families, and from engagement with drug strategy members. And all of them were a hard no to alcohol in our parks. There's lots of detail to that, but council did not ask for that public presentation on the decision of alcohol in parks. They simply decided against moving forward with that policy for now. This was a really good investment of time, and it shows how community can work together to influence policy. That engagement led to really meaningful conversations that will support us in the future if we need to share the voice of people to inform municipal policy. And we will use what we heard in our alcohol policy brief. Now, in 3 minutes or less, I'm going to try and cover the next slide. So this was a really, some great work that happened in our community. So when a community is considering a new alcohol bylaw, one of the most useful tools is a policy brief. You could think of it as a roadmap. A strong brief begins by laying out what already exists, current bylaws, provincial rules, and gaps, and then it brings in the community voices. In Lloydminster, we do this in a number of different ways to supplement the city's engagement, which would most often be a survey, and which in fact we were able to help write the questions for. We host coffee chats in the community and in the workplace through a simple guide to host a conversation about alcohol. We have a guide and we give gift cards for coffee to anyone that wants to host the conversation. The Lloydminster Youth Council started in 2016 and they host surveys and engagement specifically for youth on, they've done alcohol, cannabis, nicotine, and community experience. YLL My Home, which is our drug strategies community name, produces social media content to encourage the discussions and invite participation. And in 2016, when we were developing the alcohol policy brief, we had more than 1,500 youth and 900 adults share their perspective in a community of about 32,000. We also ask these two questions in our survey conversations. We always ask the same two questions in addition to some others. How do you see alcohol used in your world, and what would you like to see changed? It sparks a thoughtful conversation and feedback. And the result isn't just data, it's really a story of how the community sees alcohol in daily life. And from there, the brief translates community input into practical recommendations for council, recommendations that balance safety and vibrancy, inclusivity, and finally, advocacy makes the case in a constructive way. Municipal alcohol policy is never just about the rules, it's about values and what kind of community do you want to create. And as municipalities have increased expectations on supporting health, when we ask our community what their priorities are, health is always number one, and yet it's not a municipal responsibility, it's provincial. And so this is moving more to being on the plate of municipalities based on what their residents want. This is an area on policy development that gives communities an opportunity to really regulate alcohol to promote a health and safety community. So how did we develop the alcohol policy brief? Quickly, we started with research to understand what the evidence recommends as best practices in reducing alcohol-related harms. We conducted a scan of current bylaws and policies. We mapped how provincial regulations intersected with local bylaws and identified gaps and opportunities for enhancements. We engaged with the community as previously described, and we analyzed the responses. What are the main themes? What does the community agree to? And where are their tensions? And then we reviewed council's strategic plan and chatted with both council administration to learn about their priorities so we could weave the two together. We wrote the brief including specific recommendations, and the drug strategy and a youth council member co-presented the alcohol policy brief to council during a council meeting. We offer it the brief as a tool to support council's decision making, and it's had a long shelf life of 10 years, and in 2016 we'll be writing an update. There's two things that have emerged since that were not discussed 10 years ago. We have concerns over alcohol taste testing in liquor outlets. It's like going to Costco and having lunch there with all the taste testing that goes on. The taste testing in farmers markets and other venues, and how is that regulated, and what oversight can municipalities have on this? And so the research and learning will be important for us, and I'd love to have your ideas and input. And the second is the dialogue about alcohol is good for business as an economic driver for municipalities. And we'll be pulling the evidence that the opposite is true. And Ashley's covered that a little bit around, what's our deficit, alcohol deficit. And so reducing alcohol consumption is good for business. However, when less alcohol is consumed, there's less absenteeism, less impaired job performance, and less long-term disability costs for businesses. So I do look forward to some time with you during Q&A today to learn alongside you and from each of you as this webinar series continues. And Amanda, if you can take over sharing the resources and then we'll move into the Q&A, that would be great.
Yeah, thanks Lorelee and Ashley for sharing all that. That was really great. And we mentioned a few tools in the presentations that you can access to get started on thinking about community municipal alcohol policy. I don't want to rattle them all off here because we're running out of time and we really want to get to the Q&A. And we will be distributing some of the resources that were shared as part of this presentation with the package afterwards. So just to highlight a couple ones, if you want to start collecting data, we had mentioned CISUR that offers it on provincial, territorial, federal level. There are some jurisdictions like BC and Ontario that offer data on localized data on alcohol consumption, alcohol-related hospitalizations. Some of those guides that Lorelee mentioned, some of which are on the local level. And again, we'll be distributing those lists at the end. I don't want to take up too much time, but there's a lot we don't know. So we really encourage folks to share any resources that they find valuable for their communities. We're going to try and compile a bigger database and list to share with attendees of these webinars. So please let us know if there's something that we've missed or something that you find useful that we can share with the community, because there's a lot we don't know about what the tools available to municipalities, because it's different for everybody.